Kamwa Dr. Okwel kole bo kamanut kechob ak keboisie oret agenge emotunwekab Afrika asikobelis amu nyoru kaimutik chechang ako chekerge kosubkei ak waletab itonwekab emet.
Bringing the health discussion onto the agenda of the climate change platform is essential for Africa for two reasons. One is the burden of climate-related health impact is largely felt in Africa. And the second reason is we as a continent are facing much higher risks when it comes to agricultural disruption and therefore food security. So for these two reasons, we must bring the issues around health onto the discussions of climate summit, not just here on the continent, but also globally.
Kekimit ine kole nyalu kibwat sekta nebo tililindo ak mieindoab borto yekitoboni rabisiek chekiboisie eng boriet netokyingei kirindaetab kaimutik cheibu waletab itonwek.
Any discussion around financing for climate change mitigation, prevention, etc., must include financing for health as well. Climate-related health emergencies are growing. I mean, you've seen how cholera has swept the southern and eastern parts of the continent. You're seeing drought, you're seeing malaria in places we never thought malaria would reach. We need the financing for climate change to actually address issues of climate-related health emergencies as well.
Kosubkei ak ng'amutik kobun tokwek cheterchin chekang'alal eng tuiyonoto kokamwa akobo magetab rabisiek cheyomotin asikimuch kisuldae chikilisiet ak tetutik.
It's quite important for us to really re-strategize our thinking and think of things in a One Health approach, ensuring that it's not just human, animal, and the environmental sector. What about finance? How do you want to make budget lines for One Health if you don't bring them to the table of discussion?
There needs to be avenues or conduits for which the research gets to the planning authorities in the country. That is the only way that research moves from publications to mere dissemination to actionable items.
Kates Dr. Okwel kole nyalu kisuldae kakwautik chekikiaror amatatake ng'alal kityo.
If we bring the right stakeholders on the table and into the communities, then we are going to be able to see a difference. If we continue to meet and talk about it and then meet again and talk about it, then Africa is at very high risk of bearing even more burden as a result of climate-related health emergencies.
Mionwogik cheu cheptigonit, chikungunya ak cholera ko alak eng mionwogik chebwone kosubkei ak waletab itonwekab emet. Aripotenchini Kass logoiwekab emet kong'ete county nebo Nairobi, kainenyu ko Samson Kurgat.